we're excited to have Melody tonight. She wrote an article that appeared in The Guardian recently. The subject was the same as tonight's speaker talk, which is on the COVID death toll and the reporting numbers. And it caught our attention, and we reached out to her, and we were fortunate enough she was willing to do a speaker session. So we're thrilled that she's here. She's got several different interesting focus areas, and it's not just COVID. So hopefully she talks about that. But she's a health and science journalist in the Washington, D.C. area, a columnist for New Republic, and has also done some consistent writing with The Guardian and some other publications. Also the editor of What We Didn't Expect, Personal Stories About Premature Birth. So Melody, we're happy to have you. I'll turn things over. This is the 10th installment of the speaker session. So we'll turn it over to you. Sorry, Melody, you're on mute.
Okay, sorry about that. Thank you so much for having me. I think what I'll do first is sort of run through some of the reporting I've done and then open up for questions. As a journalist, the questions are my favorite part, so I'm always eager to get to that. So I have been reporting on COVID-19 since January 2020. Back then I had to convince my editors that this was a big story. I remember at one point they told me, we don't want more stories on this novel coronavirus. We think it's getting a lot of attention. And we want to have a focus on other things. And later that editor apologized and said, what else do you have? So I've also been reporting on global health for more than a decade, as well as science, with a focus on climate change. And I also report on the Arctic. So those are sort of my main areas of focus. I got started reporting on COVID mortality for two main reasons. One is I felt like a lot of people that there needed to be a way to kind of memorialize the people who are dying. And I kind of wanted to give survivors and the loved ones a voice in my reporting. And the other reason is because mortality shows us kind of the worst effects of a virus. This is kind of the worst case scenario when someone dies. So we know exactly how bad things are. And so I thought that reporting on mortality would help contextualize exactly what was happening with the pandemic and how worried we should be. Now, of course, when I started getting into it, I realized that it is a lot more complicated than that. I thought a person dies, that's a number. You can attribute that toward a tally, and you can have this idea of what the fatality rate is. But in fact, it's actually quite difficult sometimes to determine cause of death, especially when you're in stressed conditions, when things are when you're in an emergency and things are kind of falling apart. It's quite difficult even to, it was difficult in the early days to get tests. Actually, I think that went on a little bit longer than it could have. It was really difficult to get tested for the first few months. And sometimes even throughout the following months, it was hard to get rapid tests. During the Omicron surge, it was really hard to get any tests at all. So looking at mortality, I became really interested in how we kind of count this. One aspect that particularly interested me is excess deaths. So the study that I wrote about recently was researchers believe that the death toll is at least 16% higher than official numbers. Officially, the CDC puts it at 1.1 million throughout the pandemic, but the actual number is definitely higher. The researchers that I interviewed put it at 1.2 million by the end of 2022. So it's higher than that now. So first of all, I want to talk about what excess death means, and apologies for anyone if this is something that you know more about than I do, because I'm not an expert. I just ask a lot of questions. So excess deaths basically takes the rate of mortality that you would expect in a population, and looking only at, in this study, they were looking only at natural causes. So they ruled out homicide, accidents, overdoses, and suicide. So when you look at a population based on previous years, you would kind of have an idea of how many people you would expect to die in a certain year. And so these excess mortality studies then say, okay, how many people actually did die from natural causes during this time period? And then you can get an idea of how accurate your statistics are. Now, in the UK, actually, I spoke with researchers, and they said that there isn't really a big gap between what their official numbers say and what excess deaths were. In fact, the share of COVID deaths kind of cuts into the share of excess deaths. So it seems like it might even be an overestimate. And that seems to be because they had more widespread rapid testing from the beginning and throughout. And when they projected what the excess death rate was expected to be, there were actually fewer people who died from natural causes other than COVID. So fewer people were having heart attacks and strokes. Fewer people were kind of having other complicated, like influenza, RSV, things like that. But in the US, it's a different story. So the question for me is, why? And that is what I've been trying to get at in my reporting. So in this story that I recently wrote for The Guardian, they estimated that the death count is actually at least 16% higher. And the reason is lack of testing and awareness of COVID. Now, that makes a lot of sense if you're thinking about the early days of the pandemic. There was really hard to find. I don't know if you guys tried to get tested in March 2020. I did, because I was sick, and it was not possible. And I think they told me I had to be hospitalized with every single symptom before they would give me a test. So that would make sense early on. But really interestingly, what the researchers found is that this disparity persisted for the whole 30 months of the time period that they studied, from March 2020 until the end of 2022, I believe. And the reason they believe, and so they looked at how, why the excess deaths were occurring. First, they wanted to figure out, is this actually from COVID? Like, is this, like, is there some coincidence? And they found that it did track with the surges. So they do believe it was the majority of these excess deaths that they found were from COVID. And then they were like, well, why were these occurring? Is it because hospitals are overwhelmed? And they didn't actually really find that in the study. In fact, the deaths were happening right before the surges, about a month before you started seeing these excess deaths tick up, right until the peak of the surge. And basically it went down at the same time as the surge. So this was actually tracking the surge. It was actually sort of predicting a surge. And so that doesn't really point to healthcare capacity, which was very strained, which was a serious issue, but the excess death issue doesn't actually seem to be related to that. What they found instead was people didn't seem to be testing for COVID. They might have had tests available, but they actually weren't just doing them. They might have thought it was like maybe COVID isn't circulating right now, because it was before surges. And so they hypothesized that maybe when surges start ticking up, then people start saying, oh, maybe this cold is actually COVID. Or maybe it's for ideological reasons. Think people saying, I don't believe in COVID. I don't think it's a very serious thing. I don't need to get tested. So that was really interesting that this sort of disparity in reporting continued for so long, even after obviously people knew what COVID was and what the symptoms were. And politicization does seem to be in play. So I guess there's an argument that I've heard that strikes me as kind of callous, of saying a lot of these deaths are in people who are vulnerable. Often, I think we got to the point where over 90% were in people above the age of 65. And I saw the argument of people saying, well, older people are, some like they're gonna die anyway, right? It's a horrible argument. But there, there were, when you have these excess death calculations, you do count on people do die, right? People die of all different causes. But this idea that vulnerable people and older people die naturally, I mean, this is in greater numbers than much greater than we expect to see. And even if you're dying a week or a month or a year before your time, I mean, we must care about that, I think. There are conversations that you want to have with someone that get interrupted when they die before their time. There are, my father passed away in October 2021. And we don't actually know why. He passed away at home. He had a respiratory infection. He didn't think it was COVID, and the tests, by the point that we tested him, were negative. But he never got to meet his granddaughter, my daughter. I was going to go see him a week later and hug him for the first time since the pandemic began. That week would have meant a lot to me. Another year would have meant a lot to me. And I think that all of us have those stories. If you don't have those stories, then someone you know and love has a story like that. And so it is really, really important to pay attention to these, what can seem like kind of like abstract numbers and statistics. Behind each number is a story. And that I don't think I need to tell you all why you should care about something like this, but I do think like that people's lives matter. And that has been kind of like a through line of my reporting. Let me just make sure I'm hitting the points I wanted to do. I think we're also seeing repercussions from mortality echoing even now. A lot of the jobs that were the most dangerous in the pandemic are areas where we see shortages now. So bus drivers, line cooks, police officers, agricultural workers, health workers, meat packers, these essential workers, right, who keep society running, were disproportionately affected. And I think that has ripple effects even now. Things are much better now than in 2020. We just came out of a wave that was lower than our previous big waves. Personally, I think 2020 is a little bit of a low bar, that we should be, still keeping the focus on these issues. If I like talking about numbers, so here are some numbers. In the first 8 weeks of this year, 15,091 people died from COVID. That's just in 2020 so far, as of February 24th. If the rest of the year follows that pattern, just on average, that's almost 100,000 deaths from COVID alone. In comparison, there have been about 21,000 deaths from flu this season, which seems to be trending downward now. So you can have as much as 50,000 deaths from flu a year, but that would still, even in that highest projection, still be half of what the anticipated burden of COVID could be. Oh, there was one other point I wanted to make, and it just eluded me. So maybe I'll come back to that. So this is still very much an issue that I'm tracking. It has gotten better, but it's still going to be with us, right? Vaccinations are extremely effective at preventing hospitalization and death, but they need to be taken. Vaccines don't save anyone, vaccinations do. So that is going to be, I think, a continued push for kind of saving lives. I think that's all my comments until I remember that last one. So if there are any questions, or I could keep talking about this forever, probably.
Thanks, Melody. Yeah, I will turn it over to the group first if anybody has any questions. Go ahead, Aunt Rory. I think you might be muted.
Yeah,
If you want, you could put it in the chat.
Click on your box. Talk. Can you hear us, John?
Yeah, we can hear you.
You can hear me.
Yes.
Well, I just wanted to say that in the past month or so, almost every one of my friends has come down with COVID. Not hospitalized, but some cases they were in bed for a week. You know, the classic symptoms. Everyone could smell, but I mean, the sore throat, the runny nose. So it's just odd. You know, to me, it seems so odd. We're starting to feel we shouldn't go out again. But I have to say, these friends are friends that go to a lot of large events in public places, which we don't do.
Yeah, I think for me moving forward, I think especially during surges, which have tended to happen in January and July, just roughly, those are times where I kind of lay low. And the rest of the time, you know, especially in large groups, I still mask and I still like try to take precautions. More or less, my life is pretty normal-ish because I do mask a lot, and so I feel pretty comfortable doing most things.
Yeah.
So I do have a baby, so that's been a little bit different.
Yeah.
That's one thing that is quite strange to me when people say, I think there's this attitude now where the vaccines are available. If you don't take them, then it's your fault if you get really sick or if you die, right? Because the vaccines are really great. And that doesn't account for the fact, you know, even putting beyond the idea that not everyone can access the vaccines. Like if you don't have health insurance, do you know that you can get them for free? If you have a copay, are you still going to do it? There are a lot of barriers to access, but it also kind of puts the onus on people who aren't necessarily going to be protected by vaccines, right? The most vulnerable. So the people who don't mount a good response or the people whose protection fades. And also like babies like my daughter, especially babies under the age of 6 months are the most vulnerable after 65 plus. And they can't get, the reason they're most vulnerable is because they can't get vaccinated until they're 6 months old. So the idea that we can kind of forget all of this is not really reality for people living in those groups, which is quite a lot of people. But I do think that there are lots of ways that you can sort of live fairly safely and keep navigating the world that we didn't have in 2020. You know, in 2020, like people were still, you know, I had someone email me like, I cut my finger on a box. Do I have COVID now? And it's like, you know, we know so much more. That is why these numbers, like 15,000 this year, really, it makes me so sad because we know how to prevent this. Even beyond vaccines, we also have Paxlovid, which is very effective. We have lots of measures. So I think the balance for me is, you know, when the vaccines first came out and I was doing reporting, people would say, you know, the goal here, when we don't see hospitalizations and we don't see death, then we don't have to worry anymore. Okay. It doesn't matter if people are getting sick. You know, when those numbers go down, that's when we can say this is over. And I don't see that yet. It's not happening. It's happening to a large degree, but it's not fully done. And then that also doesn't even get into long COVID. And that is actually one of the points I wanted to make that I forgot was that measuring what COVID is and what COVID mortality is quite tricky. Long COVID is usually not on a death certificate unless I think the family wants it to be, like unless there's like a negotiation there or an understanding on the doctor's part. But often conditions that like long COVID or even like COVID that, you know, you're no longer testing positive, if it spurs a different condition, a heart attack or stroke or complications from diabetes or something like that, that might not also be counted as COVID. So that kind of further complicates things. So that was the long answer to your comment.
It's good. Good answer.
All right, and Rory, I think you found the unmute button.
I found the unmute button.
Great.
I'm sorry, I apologize for being late. I missed the very, very beginning. But is there any way, Melody, of knowing or any statistics? It'd probably be hard to figure this one out statistically. If testing was made more available and people took it more seriously in the beginning of COVID, would there have been fewer deaths?
That's a really good question.
Because
I think, I think that it's such it's such a big question that it is hard to say. I
That's
think so. I mean, I first found out about COVID on December 31st, 2019. A friend of mine who works on infectious disease in China, like, sort of sent this like mystery pneumonia around, and I was, oh, I hope it's not a coronavirus, like SARS, and it was. So, I mean, people knew about it in 2019. The U.S. officials knew about it. They were being briefed, and if we developed tests then, which I think would have been pretty easy to do,
Mhm.
we would have known that COVID was already spreading in, was it January 15th was the first case?
Yeah.
It was in the US. So I
Mhm.
think that we would have known, we could have like definitely slowed the spread. When things got really bad, the issue, I think, when things were really bad in early 2020, the issue wasn't the test so much as hospital capacity. I do think that was an issue, that like you could know that you had COVID, but do you still go to the hospital? And I think some of the out of hospital deaths were people who were resistant to going to the hospital, or not resistant, that just didn't go to the hospital. So you had people in nursing homes, or you had people at home who were just they were sick at home, and they didn't go. But yeah, like this, I think that was more of a factor just really early on, though. And I definitely think, like, if we'd had tests in like January 2020, that things might have been different. But that is such a big statement to make with a lot of other factors.
And I guess too, maybe comparing with other countries, if other countries had, the countries who had more diligent testing, I'm wondering if those deaths were decreased as well. Because I know there were some countries who were very more diligent than our country. So it's
I do
curious.
think that was, I mean, it's hard to say, because the countries that were more diligent with testing, I think, were also taking other precautions. But I do know that there were countries that were doing really, really well in response, including with testing. And then when the Omicron surge hit, it kind of switched. It kind of flipped a switch for a lot of countries, where they were sort of like, this is much harder to contain than it was in the past. But I mean, I think it would have made such a big deal early on. And even some of it's just practical things. FEMA was paying for funeral costs because it was a crisis, right? Up to, I think, $9,000, right? For people who died from COVID, but you had to have a positive COVID test to get those benefits. And it took a long time, if they ever paid out. So there were things that you maybe would have had sort of like logistical support for it. People who were not able to go to the hospital, who were recovering at home or in a nursing home, like, and didn't know if it was COVID, like maybe they could have been monitoring differently. Yeah, hard to say.
Yeah. Well, it's still very much alive, and it will be here forever, unfortunately.
Mm-hmm.
Yeah.
Yes.
Melody, I had two questions for you. One is, so you talked about some of the factors that led to these like discrepancies in numbers. For example, lack of testing. So, it seems like part of the onus is on those that were actually doing the reporting, because there was some kind of transfer of data between those doing the reporting and those that like got the dashboards out to people. So, do you see people that were doing the reporting, like, do you see learning going on and like, potential room for improvement for the future?
That's such a great question, because the figures that we often rely on, like for instance from the CDC, that's collected by the state, by the states, and they send it to CDC. Sometimes states would be lagging, sometimes states wouldn't send it for a while. Sometimes the definition for what counts as COVID mortality has shifted. For instance, in Alaska, if you test positive, I don't know if this is still true, but they changed it so that if you tested positive and then tested negative and then you died, that was not a COVID death, because you had tested negative before death. So things like that were kind of make data collection quite tricky. Whether that has improved, I will be honest with you, I think it's probably gotten worse. Just in terms of states working together with the CDC, I'm not really seeing that, like, for instance, in Florida with the measles outbreak, it seemed like Florida was really slow to be updating the CDC, like the response there. I'm not exactly sure what happened, but I don't even know if there were like vaccine campaigns, if the CDC was able to send a team to Florida to deal with this measles outbreak. So that kind of thing really concerns me, that there might be a growing rift between those who collect the data and the CDC. I think that's going to be really defined by sort of politics, and so the politics will probably play out geographically. So one thing I wanted to say about this study about excess deaths was there was huge geographic variation in New England and sort of the northern, like northeast. You actually were kind of closely tracking to what the UK saw after tests were available. There actually were sometimes a greater share of COVID deaths than they expected from excess mortality. So it was happening in the Northeast, but in other places, it was really lagging, and that was a persistent lag. So I mean, I'm not. I think that some states definitely learned this lesson, right? And some states really got on it, and then other states maybe learned other lessons about reporting their data.
Okay. Thanks. And my final question is not COVID related. You have a passion and an interest in the Arctic. Can you talk a little bit about that?
Oh,
Yeah, and I mean, that can be COVID related. I reported on COVID, and I didn't go to the Arctic. They were very closed down. Yeah, so I came to the Arctic by way of reporting on climate change. What I was interested in is how health and climate interact. And so I did a project on mental health in the Arctic as the climate changes. Sort of, this is the front lines of climate change. What can we learn about how to combat it now before all of us are seeing the effects of climate change? That was my like goal. But then when I got into it more, I realized like we are already seeing the effects of climate change. But in the Arctic, it's really deeply felt. Yeah, I've been to, I think, Iceland, Nunavut, Sweden, Norway, Finland. I haven't been to Russia or Alaska or Greenland yet. And I was actually trying to plan a trip this year to go to Greenland. For the past few years, it was really tricky to travel to the Arctic because a lot of these communities were quite small. And I don't think Nunavut, the whole territory, doesn't even have a hospital, much less like a ventilator. If you need a real hospital, not a health center, you have to fly 3 hours to Ottawa. And it's like a $20,000 medevac. So they were really locked down during COVID and really careful about the spread, especially because like tuberculosis is a really huge issue there. Anyway, you get me started talking on the Arctic, and that'll be a whole nother series.
That's a whole other speaker session.
Yes.
All right. So last call from anybody in the group.
Sure thing. I have a quick question. First of all, thank you, Melody, for taking the time to talk with us on this topic. I know it's an important issue that resonates with you deeply on a personal level. But I know you alluded to it previously about misinformation and politicization of information that may have contributed to COVID reporting rates. With what others have mentioned about COVID having small resurgences here and there, and also with the looming presidential election, it feels like we could possibly be due for not only just outright denial or misinformation surrounding COVID, but actually just political narratives surrounding COVID. Like the last time COVID was around, we'd see a lot of narratives and political campaigns like we can't afford to quarantine ourselves because we can't afford to pause the economy, it'll cost us our livelihood, things like that. Like medical authorities are trying to take away your livelihood.
I believe it was almost exactly 4 years ago that the president said, if we stop counting the cases, they'll just go away.
Yes, things like that.
Yes.
But with these things kind of converging again and setting the stage for another sort of similar situation, do you have any thoughts on whether you think we'll see that kind of misinformation again, and what are some things we might be able to do to combat that?
That is an excellent question. And to be honest with you, my brain has probably blocked out the contemplating more misinformation on COVID. But I have been thinking about what the COVID pandemic kind of set into motion in terms of other types of misinformation. I do think that as we become increasingly polarized, that it is really difficult to trust officials. And that's not just when your own party is in favor, but this polarization is kind of making all Americans like trust in officials plummet. We are already at historic lows. When you don't have trust in officials, that is a ripe circumstance for misinformation to flourish, because if you can't trust the people in charge, then you're trusting someone on Facebook or TikTok, or and that opens the doors for bad actors to come in and make a lot of money off of misinformation, and then also like for people to score political points and to say, COVID isn't that bad, it's over now, it was never a big deal, and that has repercussions on people's lives. So I do think that health misinformation is one of the biggest issues of our times. And I also think that the rapid proliferation of AI, generative AI, can have a huge consequence. Google search, like I've been having trouble using Google search just to find basic information, because of this proliferation of AI generated content. And I think that is going to make health misinformation a really huge issue. I think that means, like from what I've heard from people who are battling misinformation, what people need, you need to have trusted sources. You need to figure out who do you trust, and then really get to them and make sure that they have accurate information. So if that's your family doctor, then we need to be reaching out to family doctors. If it's influencers on TikTok, then there needs to be a program to talk to them, to provide good information, especially when things are getting bad. If there's a crisis, as things are unfolding, they need to be part of crisis communications, because they have a lot of influence. So it's definitely something I'm tracking very closely. And now you've got me thinking about what that could mean for COVID. Awesome.
Got it. Thank you for the detailed answer. Just some food for thought as we head into some interesting times.
Yes. Yeah. Maybe you'll see me write about that next.
Next question.
John, I have a question.
Yeah, sure.
Thank you. Melody, thank you very much. I'm sorry I joined late. I was at another call. But I do have a question regarding the sources that you look at and rate them, please, like your top 1, 2, 3, 4, if you could.
Do you mean sources of information or sources on this topic specifically?
On this topic specifically, when you do your research.
All right, so if I'm reporting on something like mortality statistics, I base it off of CDC, but I also go to people who are doing research independent of the CDC to sort of say, is this what you're seeing? Every time I'm reporting, anytime I'm trying to get down to the bottom of things, I'm always triangulating. So everything is a data point, and it's not the complete story. But if the other points line up, then I think I can kind of take that as what's happening. If the other points don't line up, then that's the story, right? That like they're different. So CDC is kind of a starting point for data, but with limitations. And then there are researchers. I talk with a lot of demographers who have been doing this work for a long time. And I also, read other publications that are kind of, that I know at this point who the journalists are. And so like I have definite priority for certain journalists who I know have good sourcing.
Do you ever get resistance from the individuals that you contact because you are a journalist? Resistance to cooperate or give information because you are a journalist?
Definitely.
How do you get around that?
Yeah. So if it's an individual, like an average person, and I am contacting them, for instance, if I contacted, this is not COVID related. So I did a story on opioids, and I saw that there was a woman who was in a settlement for opioids, and she I found her on Facebook, and so I just reached out, and when I said I'd like to schedule a call, and on that call I can describe the article to you, and we can talk about if you want to proceed. And I just kind of leave it up to them, because I think individuals, if individuals are resistant, then I don't want to interview them, because I don't think they're going to be honest with me. And I feel like I don't want to force anyone to do something that they don't want to do or don't feel comfortable doing, or whatever their reasoning is. However, if they're a public figure, then I think that they owe it to us to be telling us what's going on. So the way I get around that, it really depends on the story. Sometimes I just get stonewalled, to be honest, and I can't do a story if it's really hard. But usually what I'll do is try to find someone who's doing similar work and kind of like get at estimates. Like if I'm talking about mortality and I don't know that the CDC's figures are right, then I will call someone and sort of be like, what do you think? And sort of get at it that way, kind of through unofficial channels. Anytime, like it has been very, very hard throughout the pandemic to interview anyone at HHS or CDC, to be honest with you. In fact, I think I've talked to one person on the phone this whole time, because often it has been quite difficult. And I think that that's a failure, to be honest. I think that's a failure on their communications team, because I'm not trying to go after anybody here. I'm trying to tell the truth. And if you're not able to help me do that, I think that you're doing the public a disservice. Obviously, I'm a journalist. I think journalists are great. So I think that I would love to see communications from official agencies get way better, because I'm not trying to roast anyone out here. And there have been times where, like with the CDC, for instance, where I've been trying to get the right numbers and I can't get them. And that kind of becomes the story. Like, why don't we know this yet? Why were like 72,000 deaths removed from this tracker, and why won't they tell us? And then so when I really can't get to someone, but the story is really important, then I'll report. That becomes the story. And then I sort of like talk about the process of like trying to contact people and like how I arrived at the story as I see it, if that makes sense.
Well, thank you very much.
Thank
I
you very
appreciate
much.
that.
Thank you for your work.
Oh, thank you all for listening. Sorry, I could talk about this for a long time, so it's nice to find a community of like-minded people.
Yeah, Melody, we really appreciate it. Not just not just your observations from what you found with the reporting, but your personal story. Like you and I talked about last week, Unity Van started in the darkest of times, like pre-vaccines. So this project that you have volunteers working on is rooted in like the why, like the human element. So appreciate you joining us to share. For the Unity Bands folks, I dropped the link in the chat window. Please take the survey. We're interested to hear from you on how we're doing with the speaker series, but also topics that you're interested in. And I'm going to share my screen for a minute just so I can show you the dates of what's coming up here in the near future with the speaker series. So next month on April 29th, we have Dr. Jason Heavner from Baltimore Washington Medical Center join us. Melody spoke a little bit earlier about long COVID. That's going to be the topic that Dr. Heavner is covering. And in May, we're going to have the president of James Madison University's Mental Health Awareness Club. So May is Mental Health Awareness Month. So perfect timing for a speaker from James Madison University. Their basketball team did not fare well against Duke, but we're excited to have them join us for the speaker series. And here's a look at what the rest of the summer looks like with the dates.